Ready to call the meeting to order? I'm going to stand for the Pledge of Allegiance, please.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Robin. can you do
Okay.
Roll call, please.
Dr. Amber Caddick,
Present.
Mark Kellman,
Here.
Dr. Lim, Jeff DePass,
Present.
James McKenna,
Present.
Dr. Jennifer Todd,
Here.
and Dr. Micah Thompson.
Here. All right, thank you. Our first action item is to approve the minutes from the previous board meeting in April. Does anyone have any questions or concerns about those minutes?
I want to add that when Mandy was presenting talking about the new FDA food code, in the minutes, I put on there that our Inspect to Go program wasn't ready to go because it still had the new code in it. I meant to put the old code.
Oh, okay.
So that's the only correction that I could see.
Okay. Anybody else have any questions or concerns about the minutes? All right. If not, can I have an order to approve the minutes, please?
I'll motion to approve the minutes.
Second.
All right. All those in favor?
Aye.
Opposed? All right. Passes. All right. Financial report, Robin.
If you'll see on the page, we added a few extra morsels to it. Joni decided to put artwork on there.
Mhm.
I'm not sure if we're gonna get around counterfeiting. And then we also added an extra thing with our funds, our general health fund, 1159, the Health First Indiana, 1161, and then the local health maintenance and on the back, the non-reverting, on the back of each page. It has a breakdown of what our budget was that we asked for on the 2025, what we had projected that we would spend, and then what the new request budget will be for the 26th. Mm-hmm.
Okay. Any questions about the budget? From the financial report part of it?
Coming out of the legislative session, where did Health First land? I'd heard a couple back and forth. They were gonna retract, they were gonna,
I was gonna report on that, but I'm gonna go ahead and answer it now. Where this year we received about 2.4 million, we'll get 660,000 over the next 2 years for 26 and 27.
Wow.
So such an incredibly substantial cut.
so then I look at, they're not numbered, sorry. 1161, and we're far over.
Because we have carryover, the state encouraged, IDOH encouraged us to spin down our 2024 carryover.
Okay.
So we went to council, like February, March, April, May, asking for the money to be appropriated to new programs. And then when the dollar amount for the next 2 years came up, we pulled the brakes on not spending any more on new programs and being able to sustain some of our smaller programs that we've had in 24 and 25, that we can have in 26 and 27. So what you're looking at is carryover.
Okay. I guess, do we feel good about the plan if that program doesn't make it in perpetuity? Fair enough. For the minutes. And I just ask, frankly, 440,000 in salaries that are relying on that fund as I see it. So-
And the commissioners and I have had a conversation about it, and it's such an important part of what the county does that they have considered, if it would go away, funding it through opioid settlement
Gotcha.
dollars.
Okay. Fair. You guys got eyes on it, I'm good with that.
Any other questions about the financial report? All right. Move on to Dr. Berkin.
Not a whole lot from me, thank you. I did have couple of conversations by phone and email back and forth with Dr. Weaver, both about COPA stuff getting moved back, and then also about Healthy First Indiana, the legislative turnout. So she shares our disappointment with the decisions on the money. So outside of that, not much from my standpoint.
And it was interesting in the Indiana Capital Chronicle, they reported that there were a lot of topics that were put forward to look at between now and the next legislative session, and it was an astronomical amount, like 200 of them. And they narrowed them down to 20 topics to study. Believe it or not, one of them is safe sleep and drowning prevention, which is exactly what we fund with this funding, and so do other health departments. So, like, come on now, you know, those are extremely important topics
Right.
that still need to be funded.
Right. Absolutely. Okay. Any other questions for Dr. Brecken? All right, Joni?
Most of my work has been surrounded by the HFI, but before we go any further, I'm going to have IT show you 2 of our videos that I talked about at our last session, our last board meeting, that we did how-to videos, that the commissioners had asked for someone to come in and do the how-to videos, and so we had Lily Yeagley do them, and she did them in English, and she did them in Spanish, and she did them not only for our department, but she did them for other departments.
Oh, that's great.
Hi, need a copy of your birth certificate? I'm going to show you how to get one right here at the Vigo County Health Department. Let's go. You'll need to come to the Annex Building at 171 Oak Street in Terre Haute. The public entrance is on the north side of the building. Just look for the red sign. Once inside, head to the Vital Records office. If you're not sure where that is, ask somebody at the desk and they'll point you in the right direction. At the desk, you're going to want to ask for a certified copy of your birth certificate. Once the request is made, I'll need you to fill out an application. After the application is complete, I'll need to make a copy of a valid photo ID. You'll need cash, money order, or cashier's check made out to Vigo County Health Department, and it's $10 cash a copy. They'll process your request while you wait, and in most cases, you'll get your certified copy the same day. And that's it, quick and simple.
For more information or to request by mail, visit our website or give us a call. We're happy to help.
People approaching 65 need to realize that choosing the right time to start Medicare can have a
aquí mismo en el Departamento de Salud del Condado de Vigo. Vas a ir al edificio anexo ubicado en Oak Street 171 en Terre Haute. La entrada pública está en el lado norte del edificio. Solo busque el letrero rojo. Después de entrar, vas a ir a la oficina de Vital Statistics. Si no estás seguro de dónde está, pregunte en la recepción y ellos pueden ayudarte. En la recepción, vas a solicitar una copia certificada de su certificado de nacimiento. Vas a completar una solicitud. Después de completar esta solicitud, vas a necesitar una copia de su identificación con foto válida. Vas a necesitar efectivo, un giro postal o un cheque a nombre del Departamento de Salud del Condado de Vigo. El costo es de $10 por copia. Van a procesar su solicitud mientras espera y, en la mayoría de los casos, vas a recibir su copia certificada el mismo día. Y ya está, sencillo y rápido. Para más información o para solicitarlo por correo, visite nuestro sitio web o llámenos. Estaremos encantados de ayudarle.
What'd you think?
Very nice.
And Greta Paff was the videographer, and Ann Paff edited them. And some of them she edited from New York, so that was pretty cool. But greatly appreciated having our young adults back with us this summer. We did add a new partner on HFI before I found out what our budget was going to be for next year, and that is the New Life Food Pantry, which is an FDA-approved pantry. And if you've never seen it or gone online and looked at it, it is absolutely amazing. It looks just like a regular store. And they serve a lot of veterans. They serve a lot of the underserved that live out in that area. And it's just a really super cool operation. I also did an interview with Dr. Valerie Yeager at the Fairbanks School of Public Health, and it was HFI Lessons Learned Qualitative Interview. And so they picked some certain health departments around the state, and I got to participate, and it was very interesting, and with that compilation, we'll see what we did well and what we could have done better.
Will that come back to the board?
Should come back to the board, compiled as a pamphlet, as they have with other things that have to do with HFI.
Okay.
It'll be released through the Fairbanks School of Public Health. They also did a workforce study in public health, if you'd ever want to look at something like it, because it's very fascinating. I completed our HFI budget, got it in the state portal, did our data tracker, got it on time in the state portal, which was about this thick of data. Did our KPI survey that we have to do every quarter. Completed our HFI budget for the council, along with all of our other funds that we have, like our general health, non-reverting grant. And still participating with my INSACHO, really like it, and my HFI leadership team. Let's see, what else? And Lily's videos, but that's pretty much what Joni's been doing in a nutshell. Any questions or input?
I guess I know I keep bringing up HFI. And
No, I
speak
bring
on
it up.
behalf of myself,
Bring it
not the
up.
whole board, but
Yeah.
I would be interested at some point just to see a kind of a summary of what we did with that. I mean, this was a monumental thing that the state did, and if that's out there and I'm missing it, let me know. But I'd like to see what came of that.
So the first year, Fairbanks School of Public Health did the survey on it. And that was information Dr. Weaver tried to take to the state legislators, and most of them were interested in it.
They weren't.
Were not. And it's amazing. They picked like 3 metrics, and they followed up on it. There were other things like this that were supposed to be done, and that's been put to a halt. Once what Dr. Yeager and Dr. Weaver brought forth, all other, besides this qualitative one, were halted. I'd love to see it. I'd love to see an overview of all of this.
And I don't even mean at the state level, just within the county level. Like, what did we do as a result of HFI?
Okay.
Is what, and I don't want anybody to spend a lot of time on it, but just a bullet point or
I
something.
will scan one in and send it out, because our regional team put something together.
Yeah, perfect.
Yep,
Perfect. Thank you.
absolutely. Yes.
In addition to Mark, could you add where we currently are on the KPIs?
Yes.
Okay,
And in our last meeting, I reported that I had updated our work plan, and on there you can see the KPIs that we've selected, and then how we've evaluated them with the data tracker.
Perfect.
I think I'd like to add, though, it's kind of frustrating because a lot of those are big problems, and just, how much impact can you have in 1 year? It's very sad to me that it was cut, but that's just my 2 cents on that. All right. Anything else for Joni before we move on? All right, so our first new business is the proposed 2026 budget. Does there need to be any discussion on that prior to voting on it?
There aren't any outstanding changes. The only one you'll see is HFI, because we don't have the funds. But as far as our general health fund and HFI, and then we would like to spend down the rest of our local health maintenance. And the reason, what we're asking for it to be spent on is for contractual services, because we've always had a nurse, a registered nurse that we use contractually, and we always paid for that out of our immunization grant. And so I got the contract for that in March, and got all the stuff from the state at the end of March, like on the 26th. And then I waited for our portal information to come through, which would have begun on the state's fiscal year of July 1st to June 30th. And at that time, when I said, hey, we're still looking for this, they were like, oh, we forgot to tell you, we're not funding that this year.
Can I ask one question?
Yes.
I caught this earlier. As far as a big chunk was building renovation even, went from,
To the Vigo County Parks and Recreation for Griffin Bike Park.
okay. And then like supplies I saw, so that's anticipated that's gonna get a hit next year. Or you just don't need it.
Well, we're going to have to use, one, I'm waiting to see what our carryover is going to be from this year. And I do know there's going to be carryover because I have to write in for full family insurance, and that's not the case. And so I know right there that I'll have to go back and have that money appropriated by the council next year. So
There's some planning around.
I've been planning, I've got plan A, B, and C.
Okay, all right.
Any other questions or concerns regarding the budget? All right. Someone like to make a motion to approve the budget?
Motion to approve. I can second.
All right, all those in favor?
Aye.
Opposed? All right, budget passes. Thank you. All right, next up on the agenda is Amanda Puller with the health fee collection ordinance.
Okay, hi. Can we switch the two?
Sure.
Because I feel like the fee ordinance goes after the swimming pool ordinance.
Okay.
With the swimming pool ordinance, we been having some issues with our swimming pool facilities as far as not knowing what to do with their pools, having to correct the issues. So one of the things that I put into the ordinance was that we require all the facilities to have at least a certified pool operator or a aquatic facility operator on staff, which is basically like a course that they take that teaches them how to man their pool properly, keep records, and all of that. Along with that, I did some increases on the annual fees. So the seasonal fee and the annual permit fee was increased by $50. And then we added in a few fines, because right now we don't have anything that we can do if we have a pool that opens after we've closed them. What else, Amanda?
Not repeated of the same violations. We're having trouble with getting some of them to like correct certain issues, and they're just repeated over and over, but not enough to like hold their permit necessarily, that we have nothing to back it up with, I guess.
How many public pools do you serve in this area?
Around 42.
Okay. Is that pretty common for across other counties to have that operator, the AFO and CPO?
This is something new for us. I know Hendricks County requires it. With that many pools and as many issues as we're having, is what it is they're relying on their maintenance guys to take care of the pools, and they don't know anything about the pool.
Yeah.
So we'll go in, the pool may not have any chlorine in it, so we're closing the pool anyway, or the spa will be off the charts.
Yeah.
It's just a risk factor that we're looking at.
How much is that to the pool owner to take that course?
Do you remember?
I want to say the course is around 200.
That seems right.
Okay.
And it's good for 3 years. And the AFO course is even cheaper. Yeah. That's all I have on that, unless you have any other questions.
All right.
And is there start dates for this? Is it effective January 1, or is it?
What I would like to do, because if you guys pass it, then we have to take it to the commissioners, and we have to advertise it. We'll send out letters to the pools, and we've talked about it, because the pools renew their permits in April. I would like to make it effective by April. So we'll just kind of give them a good leeway on, hey, you're going to be expected to have this training, and these fees are going to be going up. So they'll have from now till April to get
things in line.
Thanks.
So I'm guessing that the splash pad that's going in on Locust, that would be an AFO that would run that, aquatic facilities?
It's just the
Either
training
one.
they take. It could
I
be
gotcha.
either one.
I got you, okay.
It just teaches them about the chemical levels in the pools and what to do.
Perfect.
And the different diseases that can happen if you don't have your stuff right.
Perfect.
Any other questions on the pool? Someone like to make a motion to approve the standards for public health and swimming pool facility?
So moved.
I'll second.
All those in favor?
Aye.
Opposed? All right, motion passes. All right.
Okay.
Now, fee collection.
The next one is our fee ordinance. So the changes that I've made in the swimming pool ordinance is reflected in the fee ordinance. We do have one other little change, and that's to our TB tests. Robin wanted to increase those by $5, so going from $15 to $20. And if you have any questions about that, Robin can answer.
It just kind of put it in line with some of the other fees is what I'm saying, seeing $20 here.
With the TB, she has done the figures on it.
Gotcha.
It's just if the vial would go up at all, where we
Yeah.
start losing money,
Yeah.
and then you have to.
So there's some math behind this, it looks like.
Yeah.
Okay. Good, good.
Any other questions about the fee collection ordinance? Anybody like to make a motion to approve?
I'll make a motion.
All right, all those in favor? Opposed? All right, motion approves.
Thank you.
Amanda. All right, Loretta.
I'm still talking to Joni and Mandy about taking the birth and death cost up. Hopefully by the next meeting, we can have a fee set. So hopefully January 2026, it could be set. I'd like to still keep an eye on how many's coming in from out of town to get their birth and death records. So hopefully by next meeting, we can have something set for you guys. Okay? Any questions?
I have one question.
ahead.
So I saw the video. Do we not take credit cards for that?
No.
Okay.
We
Did we at any time?
We did, and it just didn't really work out. It's too much of a cost.
Gotcha. Fee per
Yes.
use.
We would really like for us to have another machine put in for ATM. We used to have one of those,
Yeah.
see really down here, and they took it out. We'd really like to have that back.
Mm-hmm.
I believe we've asked the commissioners, correct? And have you ever heard anything back or anything?
They were wanting to go to all the departments to see what their feedback was on it first. And then the problem was the price that they were saying that
No?
the price was just so high now, like.
Because when they come to our window,
Mhm.
they've asked about the credit card, and we've told them no, so they've asked about the next, where they could go to get money out, and the closest one is the gas station.
Okay.
So they go over there.
Okay.
We do take personal checks now, though.
Okay.
That helps them out a little bit.
Yeah, I've recently worked on a project at the hospital to bring in an ATM, so we can talk after.
Okay,
Have contact.
sounds
Yeah.
good.
When's the last time we've changed the rate on the birth and death certificate?
For Vigo County, it's been, I want to say 14. From $6 to 10. Any more questions? Good?
Thank you, Loretta.
Thank you.
All right. Or is there any old business to go over today? I don't think so. All right. program updates. Loretta, I'm sorry, I just made you sit down, and here you go again. Vital statistics.
Okay, Vitals is still busy with birth and death records. We have seen an increase in agencies helping customers obtain their birth records over the last 3 months at no charge. We have seen more customers request for out-of-county births. We are keeping an eye on that. I am still talking to Joni and Mandy, of course, with the fee. And hopefully by the next meeting, we will have a fee set for you guys. That's about all I have. Do you guys have any questions? No? Thank you.
Thank you. All right, vector control, Mike Graylands.
Good evening. Before school let out, we distributed our coloring books again, our Skeeter Beater coloring books, about 5,200 of them. The state started accepting mosquitoes June 1st, so we started our light trap program. So far, we have collected 30 pools of mosquitoes. None have tested positive for West Nile virus. The state has had 35 positive pools so far in 9 counties, or I'm sorry, 25. I should have worn my glasses. We sent in 4 bats for rabies testing. All were negative for rabies. We're still picking up TARS. I've had the privilege of having 6 wonderful 17 and 18-year-old kids working with me for a while, and it's been an experience. They've been picking up TARS for us, and they've been expanding our catch basin program. And I was telling Mandy earlier, we've probably added another 300 to 500 catch basins that needed to be treated throughout our community. The kids have done a great job, and of course, if you know anything about 17 and 18-year-olds, it's put a few more gray hair on my head. But it's been fun. It's really been fun having them. We're still doing our catch basins. We're just about wrapped up with that. We're still collecting our TARs. The guys brought in a couple loads again today. Seems like you clean up one area, you got to go back and clean it up again. Our night program's doing well. Our day larviciding's doing well. I look first to have West Nile positive before long. You know me, I get up here every time and I tell you we need rain. We need rain. I believe with the 90-degree temperatures we've been having and the lack of rainfall, we probably will be getting West Nile positive before long. But so far, knock on wood, we've not had. And that's about all I've got. Anybody have any questions?
I did hear today that, and not confirmed, but I did hear they found a West Nile mosquito in Clay County.
Clay County,
So
yes.
It's coming.
Yes, yes. Yeah, right in Brazil.
Oh.
Yeah, right in the city of Brazil. So, yeah, I just about know the location, but. All right, thank you.
All right, thank
Thanks,
you,
Mike.
Mike.
Thank you too.
Pardon?
I know.
I bet you do, Joanna.
So do we add hazard pay to Mike's salary for dealing with so many 17, 18-year-olds?
Sure.
I think so.
Sometimes stipend.
Yeah. All right. Shelby with health education.
So some of the topics covered for this past quarter were obviously tire amnesty, measles, ticks, and mosquitoes, the fogging schedule, updated food code, the local health department funding, sun safety, and drowning prevention, and that was across WTHI, WTWO, Tribune Star, as well as Fox 59 and CBS 4. I think they are based out of Indianapolis. We did a few virtual interviews with them. I'd like to give a thank you to Mike and Joni for their quick response for allowing Greene County residents to dispose of their tires following the tornado and the storms. I live in Greene County. I was notified that a lot of the residents did not have any proper removal services, so I quickly reached out to the two of them and we tried to work since we did have tire amnesty program going on. And I believe we had a few come up and actually turn some in.
Wow.
Amanda Baker and I held our first Serve Safe session about 2 months ago. 9 people showed up, 8 passed. Our next session is going to be 2 weeks from now, and they follow through the rest of the year, the last Wednesday of each month. I partnered with Union and Luger Center to complete their HRSA grant, since a huge portion of theirs is based off of the Fetal and Infant Mortality Review Team. So I sat down with Hisham and we kind of showed the grant overseer how it rolls here in Vigo County. And the most biggest thing, well, hold on for that second. Some trainings that I did, we did a media training with Indiana Department of Health, Shandy Dearth, and Indiana University to encompass and kind of mitigate all the language that public health uses across different counties and see how different counties work. Also did a training for virtual reality for firearm safety, building trust in public health guidance, slowing speedy drivers, and public health communications. Now the biggest thing that probably happened during this past quarter is the Safe Sleep trailer. And not to float my own boat, but it was a pretty good event, I think. It was a good turnout. We had a ribbon cutting here, and appointed officials, different department heads, and other community organizations such as Chances and Services for Youth came out to show support. We have gone to some different area events. We're kind of putting a cap on our travel right now to about 80 miles. So 2 hours to an event, 2 hours back, so that way we can spend about a day there, just due to some of the funding and budget. I'd like to thank Mike and all of the staff at Vector Control. You guys did so much work on the trailer, so thank you. Hopefully, it was a good learning opportunity for putting together a crib. I think the compound set a record for the amount of people and the time it took to put a crib together. We attended the Public Health Nurse Conference, and lastly, I presented to all staff of Indiana Department of Health today about the Safe Sleep trailer, and I was a little bit shocked when I looked up and saw the attendance amount on that call. There was over 1,100 people. So the whole state now knows about it. And I believe it is the first Safe Sleep mobile program in the state.
Great.
Nice job.
Any questions? That wraps up my past quarter. Thank you.
Robin with the clinic.
Hi, I'm Robin with the clinic. I want to go over some of the things the clinic has been doing. Oh, sorry, I'm short. The clinic staff, along with our lead case manager, performed lead and hemoglobin testing on April 22nd at the Head Start. We tested about 20 kiddos, and we will return on September 20th. On May 23rd, the Indiana Department of Health passed the clinic on our annual state visit with no compliance issues. The nurses and I attended the Public Health Nurse Conference in Carmel. Katie Mundy is learning lead billing, and we have a big upcoming event. This is very exciting for us. It's called the Fall Vaccine Bash. It's Saturday, September 20th. The clinic staff, along with Shelby Jackson, is going to host a health fair / vaccine clinic. The hours are 10 a.m. to 3 p.m. This year, we are trying a new strategy to capture more attendees. This should align better with Vigo County School Corporation and the reminder letters that they send out. Face paintings with local tattoo artists to teach the importance of safe tattooing, along with the Terre Haute Fire Department that will talk about fire safety. Bounce houses and kettle corn too, along with several other vendors. Please come out and enjoy the festivities with us. Is there anything else you guys would like to know about the clinic?
I was kind of curious. I saw we had 3 cases of histo. Do we know, like, how that was contracted, or if it was like due to bird flu downtown or anything like that?
No, I mean, the nurses do work the cases, and I mean, they work them to the very end, and some of the patients do talk to them about it, and then they'll close them out. But I do know one lady, it was through goose poop, I believe.
Okay.
and she was an older lady, so, I mean, I think she had like a pond and some property. I believe that's what that one was from, but.
Something else we included in your packet was something that we didn't know existed. Our past director of nursing received it, but Dr. Brucken and I did not. And it's the weekly infectious disease case count for Vigo County. And it's an interesting document because it tells us a comparative analysis weekly count from last year till this year. And then it says whether we're remaining the same, whether we're seeing a spike in something or a decline. And I don't know if any of you are interested in receiving this, but if you are, just send me an email and I can include you on it. It usually comes out on a Thursday.
All right. Thank you.
Thank you.
Thank you, Robin.
Environmental, Amanda.
Okay, so the environmental program. We've been busy doing training, so some of those include our on-site sewage training hosted by IDOH. We attended the IEHA Spring Conference, rapid response training for food, a pool workshop, and other trainings. Andrew, Martin, Shelley Rubinacci, and Amanda Shook all became standardized under the new food code, and that was completed at the end of May, so we're all there. That was a big task. Our on-site sewage continues to be super busy with installs and replacements of systems, and our food division is super busy with our fairs and festivals. And we just completed our inspection with the Vigo County Fair with over like 40 vendors. That's pretty much all. Any questions? All right, thanks, guys.
All right, thank you, Amanda. All right, Molly with Social Services.
Hi. So all of our programming is on track, like we had talked about before. MRT, peer coaching, the change program, and the seeking safety that I'd mentioned in the last meeting is all going great. We're in collaboration with the courts still. They're ordering clients to take the seeking safety. I won't bore you with all the numbers, but I do want to highlight, they're in there for you, but I want to highlight the work that Jeremy's been doing. He's went in there, guns a-blazing, if you must, and has just hit the ground running and has been connecting all of these people who have been leaving the jail with the resources and closing the gap on the barriers that they'd had before. And it's been incredible to see. And I've made a list of all the things that he's connected these individuals with and the number of individuals he's connected them to, if you will. One of the things that I want to highlight, though, we had talked before about one of the issues that they have when they're leaving, and a lot of times they don't have clothes, right? So he's made these connections and now takes them to get clothes. He's made connections with food pantries because they don't have food, right? So he takes them himself to get the food. We had a guy who contacted us, and this guy wasn't in the jail, but he had lost his Social Security and was like failing at, getting that back. Jeremy's like, okay, come in, let's do this. And so Jeremy took him in, hooked him up, and now he's on his way to get his Social Security benefits back when he's been basically homeless, right? Because he hasn't had any income. And so seeing those things just fill your cup, right?
Yeah.
And this is what this work is really about. I mean, it's about, teaching them the right way to live, but if they don't have the means to live it, it's not going to matter. And so this piece of this puzzle, it was so needed, and we're so thankful for the work that he's doing, and I just really wanted to highlight that. I had talked to Joni earlier. I've been working on you had asked in the last meeting about the numbers, what the difference was from the people who were in the program versus the ones who weren't, and the rearrests and things like that. I'm working with Charlie Funk currently, and I wanted to have it done for this meeting, and he's had conferences, and we've kind of missed each other, so I didn't get it all the way done, but I want to give you what I have gotten done so far. piece of paper, it has where each person went, whether it was DOC, if they're still currently in the Vigo County Jail, whether they went to a sober living home, if they got rearrested, and those are the participants who completed the MRT program. And I still have some more to add to it. As the last few weeks, I haven't added the ones who have graduated, but I want you guys to see that picture. And so my goal is in October when we meet again, in October, right? In October when we meet again, I want to have like a graph so you can actually see it. I think that'll give a better view of how well we're doing, or, you know, what the numbers are, I guess, so to speak. Oh, and I want to give you this too. So Shelby Jackson and Jeremy teamed up and made this resource guide. So in the county jail, they don't have a phone book. They don't have a way to look up numbers of places that, you know, they need to get a hold of, or sometimes things they don't think of at all, right? And so Jeremy put this together. We got it approved by the jail commander, and Shelby helped him make it. So I'm going to give all you guys one of these.
Thank you for the work on the data. I mean, yeah, you're really collecting some good numbers.
There's a lot of orange on there.
There was a
Orange
lot.
teams are doing well,
Yes.
so.
I think I speak on behalf of the board and maintain that this is great work, very exciting.
Thank you.
So appreciate what you're doing for the community. I guess I've not seen the report yet, but have we thought about long-term tracking? Which is to say, my assumption here is you're following up on 100% of the graduates.
Yes.
I don't think we can do that indefinitely.
Yes,
So I
we
guess
are
what is
working on
what
it.
is the time period where we're gonna follow them for X amount of time and then,
There's not one.
you know? I just think 8
I mean,
years from now,
honestly,
you're
there's
gonna
not
have a
one at this
list
point,
that's
yeah.
not manageable, and
Can we do an AI program to make it work?
there you go. There you
Right?
go.
So, and an update on PJ and Gary, they're both still doing phenomenal. And PJ just keeps excelling, and so does Gary. I mean, they're just doing so good. I'm just so proud of both of them. You know, we have other clients who are on their way too, so it's not just them at this point, and we may bring them in at some point so they can, you know, report to you guys. I think it's cool that they got to do that, and it actually gave them like this boost and this purpose and this, I don't know, yeah, it was cool.
That's great. I was going to say, thank you for the work you're doing to partner with the jail too. It sounds like you're really making that relationship work.
Yes, yes.
Has to be in place to do this, it sounds
Yeah,
like.
yeah, and we have a meeting coming up, the RISE meeting that we call it, and so we'll meet with the jail commander, the sheriff, some of the judges, the prosecutor, and it's this collaboration that it's just been amazing to see, so.
We've also been fortunate this summer to have Dr. Turner's daughter, Katie Turner, with us. And she had some lag time between her undergrad and doing her master's degree. And so she's been going in and doing peer recovery coaching in the jail.
So what Katie got to do, which was really neat and a great experience for her, was the Seeking Safety. So I gave her a lesson and let her take it home and study it, and then she went in there and just killed it. Taught a class, and they just loved her. And so it was really cool. And this is the line of work that she's wanting to do when she graduates, and so she's going to fit right in.
Great.
Do you have any questions?
Yep, just one thing, because we had the Vigo County Drug Free Task Force meeting today, and we learned that Al-Anon and Alateens numbers are really dwindling. So I don't know if we can connect to help the families also cope with the recovery, because those are
Absolutely.
great programs.
Yeah. I just referred somebody there just recently, you know, because a lot of our clients' families don't understand.
Yeah.
And when I was young, I actually went to Alateen in Clinton, and so I was able to say, if we have this. But yes, I think that would be. I hate it that the numbers are dwindling because it's so needed.
Yeah.
Yeah, I'll definitely keep an ear out for anybody who needs those services to try to boost those numbers.
Awesome. Thank
Yeah,
you.
You're welcome.
Any other questions from all? All right, thank you. All right, do we have any citizens input for tonight?
I have two things to add.
Okay, sorry.
You'll notice at the top of our minutes, it appears to be different. There's different language, which now becomes a requirement as of July 1st for any municipality.
Okay.
So all of our meetings, which we always have streamed and archived, we just have to say that. We now have all of our board packets online, and just for better transparency with the public. And then second, going back to what Mark had originally asked me about sustaining our program if HFI continues to dwindle or go away. Dr. Todd and Brandon Halleck and I met with the commissioner and council to talk about using the opioid settlement to continue funding what they're doing, which we're currently funding with HFI. We are not going to be able to fund the great big programs, the RISE program, or the one that they're doing at Chances for Youth with the school corporation and Lucky Reddy's Court, Judge Reddy's Court. I also met with the judges and met with the commissioner and council for the same reason, because they're looking at continuing those programs, the continuity of them. And so we haven't spent any of the dollars yet. They've been productive meetings, but I think there'll be a positive outcome.
Thank you, Jen.
Thanks, Joni. I did have, I think, maybe back to Robin, update on measles. I guess just wanting to learn about I know there was a case recently in Putnam. Did we have any exposures that were from Vigo that we know of? Am I understanding correctly, IDOH is doing the contact tracing?
Yeah, I mean, we haven't had any here in Idaho County, and we've been watching very closely.
Okay.
And I noticed that the hospital is now screening for
Yeah.
measles.
Yeah, yeah.
Which always is good, because when we had the largest chicken pox in the United States, a lot of doctors thought it was a rash.
Mhm.
Same with whooping cough. There's a lot of diseases that they haven't seen that are making a resurgence.
Mhm. And then the final question, sorry, I have a lot
That's
tonight.
okay.
House Bill 1001, Section 127, around the mental health. Do we fully appreciate yet the impact that's gonna have on the county with respect to Hamilton Center and how that's
No.
gonna play out?
No.
Okay.
I had a conversation the other day about it, and there still isn't any feedback on what Hamilton Center is wanting to do or what they need to do. And for one of the things they're going to have to look at is the fact that they have all these satellite locations. So they've been receiving revenue from Marion County. I mean, every place that they had, that became part of their operating fund. And so with that, if they have a non-clinical employee that makes over 400,000, they don't receive that funding.
I guess, okay.
Is that what the question you were asking?
No, it
me?
is a question. I'm just curious. I mean, do we need to be proactive and start conversations with other potential partners or prospective partners? Or is it too early? Maybe see how it plays out?
See how it plays out. I was expecting out of this last legislative session for the legislators to change the language away from designated mental health providers they were the only ones that could receive that funding. And I thought they were gonna make it a little bit more broad, because we do have so many other mental health providers that aren't considered designated mental health.
Okay.
We're gonna have to play it as it lays.
Because the deadline was actually July 1, right?
It was,
Okay.
but there's been nothing from Hamilton Center, and they've been notified, and they said they're working on it, but it'll be interesting to see what that looks like.
So officially, we're out of compliance.
Officially, no funding has gone to them after July 1st.
Oh, okay.
And I don't know how at what time frame it's distributed, whether it's during fall and spring settlement of taxes. I'm not for sure, but they're not going to receive it as long as they are not in compliance with the new law. And I think ours is a little under 800,000.
Is that what it is?
Mhm.
And the concern is just access for the community and the underserved population already.
Right. They're also, oh, sorry.
Now, is it difficult to become a designated mental health?
I don't know.
Do you have any idea?
I don't. I would think that if it was easy, that more would do it, because again, mental health taking such a broad step forward in the last 30 years of, being destigmatized, the immense need for it. But I don't know why there aren't more.
There are a lot of steps. I'll tell you that. It's staff, and 24-hour services and just a lot. So I think there is that restriction. If the language stays the same and doesn't change, then the funding gets restricted. And so that is the frustrating part with this, so.
And Mark, I think also that's a conversation, there's going to be, has to be a serious conversation with Hamilton Center's board among them on what direction they want to go. And I think that's really, you know, when you accept a board position, you're taking it seriously for the mission of that entity. And so they're going to have to look at where do you start balancing out the needs of the community, what you're there for, and being in compliance with the law.
Do we have an appreciation of the volume of patients that end up in Hamilton Center because of the relationship with the health department?
I don't know that.
I do know they're the gatekeeper for the state hospital too, so if you need someone who does need to go state hospital, it has to go through Hamilton Center, so.
I didn't know that.
Yeah, I'm pretty sure it's true. Yeah, so if you think about access in our homeless population and mental health and all that, I don't know how it's all connected, but, I'm sure there's some connection. Any other questions, comments, citizen input? that we can- All right. Can I have a motion to adjourn? All right, second? All right, all those in favor?
Aye.
All right. I'm guessing no one's opposed. I'll see you all on October 15th. Thank you.